Hello, I'm Dr Shuja and I'll be going through the post-op instructions with you today.
I'm ready to leave. I've got to keep this on until tomorrow. But I'm excited. Thank you guys so much. You've been amazing.
So you'll be given a pack. Within the pack there are a few things. You'll also get all the instructions written on a piece of paper. Let's go through the pack. So today is day 0, that's the operation day. And there's only a few things that you need to do today. You have within the pack 2 sets of painkillers. This is cocodamol. You take 2 of those 4 times a day if you have pain. The other one is ibuprofen, 1 tablet 3 times a day, commonly known as Nurofen. You can mix and match these. I would suggest maybe going with the ibuprofen first because it helps with swelling and inflammation. The other one, cocodamol, can make you a bit drowsy, so if you're driving, do not take this. Other medication that you do need to take, this is the antibiotic. This is the penicillin, the flucloxacillin. You take 1 of these 4 times a day. So you can take your first dose today before your evening meal, preferably half an hour before the meal. Then tomorrow you can take it 4 times a day. You take it before breakfast, before lunch, before tea and before supper. When you finish this course, this is a 7-day course. Okay? So painkillers as and when you need, the antibiotics for 7 days, you have to take this. The only other thing you're doing tonight is sleeping. So we've given you a neck pillow. Please do not blow this up yourself. You can get some family member or partner to blow this up for you because that will put too much pressure on your head. So how you sleep is exactly how you were in the last part of the procedure, which is the implanting stage. So you want to be at least 45 degrees, so do plump up your bed with some pillows and then use this neck pillow, and that will stop you from rubbing your grafts and use the actual pillows. And ideally you want to sleep like that at least for 7 to 10 days.
You have to sleep quite up, so pillows, elevated pillows all over your back, and then with a neck pillow on as well, and you're sleeping like this because you can't do anything to the top of your head. I need to avoid touching that pretty much for the next 2 weeks in any capacity.
So that's today done. Tomorrow is day 1. The first thing you do in the morning, you wake up, you take the bandage off.
Day 1 of recovery, and it's time to take off the back bandage to see how that's looking. This has gone, it looks good, it looks alright, it's not too bad. I didn't know if it'd look completely gross, but at the moment it's okay. It just looks a little bit like a red hairline. I'm wearing buttoned shirts because it's recommended that you don't pull off any clothes over your head, so I've just got an abundance of button shirts to wear over the next few days. I'm just going to hand the camera over to my lovely girlfriend Ariane, and she is going to take off my bandage.
I really want to pull it off like a plaster,
Please
like
do
really
not.
fast. I'm not going to, but it's that temptation. Like that side's done. Do you want to spin around a little bit?
Keep going, there's tape on the bottom. Yeah, feel something on the back of my head still.
There we go.
Oh.
Lift your head up.
Okay, that is day 1 of the donor area recovery. Okay, so the back area you've just seen isn't as important as the front area. Obviously it's important, you need to look after it, but I don't have to be quite as careful.
You wake up, you take the bandage off, and then you have to start spraying this saline spray on the transplant area. Now that could be the front, it could be the crown. You spray, just like perfume, 3 or 4 sprays on that area every 3 hours whilst you're awake for 4 days.
The main thing I'm doing at the moment is just making sure I'm spraying my head every 2 to 3 hours with saline solution, which British Hair Clinic did give to me. The swelling has been quite intense in the forehead area. It started quite high up and it was lumped out at the top there, and now it's come down to just above my eyebrows, so I don't know if you'll see it very well on camera. But I've taken some photos as well, so if this doesn't show well, I can put some photos up on the screen.
In the morning of day 3, you use some Savlon to the back of the head like so, which is the donor area, and in the evening you use some tea tree, a few drops of this, and just dab it across the back of the head. So morning, evening, and this combination can carry on for many weeks. Just do not put this on the transplanted area.
Day 3 post-op. Today was the day that I could start cleaning the donor area, the back of my head. It was Savlon first thing in the morning, which is just a cream you rub on, nice and easy, and then at night, before I go to bed, I'll be using tea tree oil.
Let's move on to day 5. Day 5 is the first time you can actually wash your hair. And how you wash your hair is not how you normally wash the hair, it's how you wash a baby's hair. So you get a small jug, a couple of drops of baby shampoo, mix it with lukewarm water and just pour it over the head. And then with clean water, rinse out the shampoo. And you do this without touching. You can do this in the sink or the bathtub, and then you let it naturally dry. So no towels, no hair dryers.
I said I'd come back today because today was the day that I could wash my hair. Kind of wash my hair at least. It felt a little bit weird because the way you actually wash it is the same way you'd wash a baby's head. So you put a little bit of baby shampoo inside a jug or a big cup, and then put some lukewarm water in there and make sure it's all mixed together, and then you pour that slowly over your head.
And you repeat the process on day 7, 9, 11, 13, so every other day essentially.
Today was also the day I sent off my first progress pictures of the top and back of my head to the British Hair Clinic. They said they were really happy with the progress so far. I'll show some pictures on screen whilst I'm talking now, just so you can kind of see how that progress has gone up to this point. Obviously you can see it a little bit, but I'll put some proper pictures on there. 9 today. I didn't really need to do an update video, but I just wanted to kind of let you know how my last few days have been, since I haven't done an update since I first started washing my hair, I don't think. So, as you can see, the majority of the scabs are kind of going now. It looks completely different to how it did even a couple of days ago. The back of the head, I'll put some photos on the screen, but the back of the head looks pretty much fine. I'm sleeping so much better. But the main update to tell you about is that I've actually been leaving the house. Not really been getting any weird looks, which was my main worry, that people would stare. It was nothing to worry about. So yeah, this is kind of it now. The next update will be when these scabs start falling off.
And then day 14, you give it a proper wash. Get your hands in there, get rid of all the scabs. Some of the hairs will stay. Those will eventually shed as well. Those are the shafts that come from the transplant. Those are not the permanent hairs, so do not be alarmed that they're falling out. You don't need to babysit them, just wash them normally, and the real hairs will grow from the roots around about month 4. And that essentially is the post-op. It's pretty straightforward, and it is all written here for you. If you're not sure about anything, you drop us a WhatsApp message and we can follow that up.
This is it. We are pretty much at the end of the whole process now. It's day 14. We are through the whole recovery, really. I've been living life fairly normally for the last few days, still sticking to what I've been told I'm allowed to do. I can now go back to exercising. I can go back to wearing hats if I want to. I'm wearing normal clothes. I did everything to an absolute T, but you can see there the hairline is absolutely ridiculous compared to how it started. So at the moment I'm really happy. The shedding process has started a little bit. I've seen a fair amount of hairs knocking around, falling out when I've been showering, and just throughout the day I have, like, kind of, if I touch it I can sometimes occasionally see the odd hair, but I have been warned of that. So shedding is a process that can happen over the next couple of weeks. It's essentially where the new hairs can fall out, and yes, of course it can be very worrying, but I'm told it's normal, and over the next few months where those new hairs disappear from, the graft is obviously still in the hair, so it's not a worry because it is going to grow through, but it's probably going to be about four months until we start to see some real progress, and then over the next year to year and a half it's going to be perfect. I need to send my final progress photos through to the clinic, and hopefully they'll be happy with what they can see as well.
Hello, I'm Dr Shuja, and I'll be going through the 5 most often discussed points post-procedure. Now, first and foremost, the most important thing to do after the procedure is not bump your head. It's very important, especially in the first 2 days, that you don't do this, and be vigilant of this, because your head will be numb and you won't realise you've banged it. Point number 2, painkillers. Do take painkillers at the first hint of pain. Do not delay, because this can also affect the healing and the recovery. If you do notice any sort of pain, then you have the ibuprofen and the cocodamol to take as you please. Point number 3, some of the things to avoid. Essentially anything that would get you sweaty. Sports, contact sports, running, cycling, sexual activity, you need to avoid those for 2 weeks. Point number 4, often patients ask about restarting their medications. So if you're taking minoxidil, you would have stopped that 1 week before the procedure anyways. You want to give it at least 3 weeks post-op for the skin to heal, and then you can restart that. Finasteride, if you'd been taking finasteride before the procedure, then there was no need to stop the finasteride, you just carry on as before. If you've been given a new prescription of finasteride, then what we normally say is start that finasteride after you've done the 2-week aftercare. PRP injections, you'll be called in 6 to 8 weeks post-op to come in and have your first PRP, and then you can decide on the protocol PRP thereafter. If you've been using a laser cap, you can restart using the laser cap after 2 weeks. Point number 5, about haircuts. Now most patients ask, when can I get my first haircut? Now you would have been shaved, so the hair will generally tend to grow 1.5 centimeters every month. You can clipper the sides and the back being the donor area, after 4 weeks. The recipient area, where the transplanted grafts were put in, you should not use clippers for at least 6 months, and stick to scissor cutting any new hairs.